Hi, my name is Clinical Finance and you're watching the video on the management of pseudostrabismus. As you're aware, a pseudostrabismus is simply the appearance of an eye turn or a manifest strabismus. The patient has no manifest strabismus. And if that's the case, assuming that there's no other pathology, the patient should have good BSV and equal VA. So these patients are generally discharged from the clinic. The most common type of pseudostrabismus that you will diagnose is the pseudoesotropia in the infants. Infants with a wide epicanthus and large epicanthal folds. That's the most common presentation that we have, and it's the most common strabismus or pseudostrabismus you will diagnose, and generally parents will arrive with the impression that the patient has a esotropia. However, there are some instances where you might want to monitor the patient. One is if there is a family history of strabismus. You may want to see them again, say in a year's time, rather than discharging them. If there's any history of closing one eye in sunlight, this could be an indication that there's an intermittent deviation, and specifically we're looking at an intermittent divergence excess exotropia there. And lastly, if you do a cover test and the patient's straight, but you see a large latent deviation, then it may be that there is an intermittent deviation there. That latent deviation breaks down to being manifest, so you want to monitor that patient as well. But generally, if you don't see any family history of strabismus and there are no other symptoms that make you think that this could be an intermittent deviation, you can discharge or safely discharge the patient. I also recommend, when I've diagnosed a pseudostrabismus or a pseudoesotropia in infants, that the parents ensure that they go to their 3.5-year-old maternal child health nurse check. At the 3.5-year-old check, visual acuity will be assessed, at which point any amblyopia or potential amblyopia can be picked up. And should we have missed an intermittent deviation early on, or should the strabismus develop later, we're still detecting the strabismus early on through that screening program. Okay, that brings us to the conclusion of this video. Thank you for watching.